Cindy Trubisky. I'm from the American Lung Association.
And once again, Desiree Tempa from One City Health Services.
Well, we are co-chairs of the New York State Subcommittee, which was convened separately for New York City as well as New York State. And we're happy to share with you some of that. Just to briefly go over, first of all, the thank yous to all the committee members. So if you were on the committee, could you please just stand up real quick and be recognized? The list is long. There's a lot of people here.
Yes, come on. I see your faces from New York City throughout the state. So
Yes. Okay, there's a lot of people. So
yes.
Thank you so much.
Give yourself a
Okay, so we wanted to quick reframe what the committee was really charged to do quickly. And so what we were doing is really we were charged to convene the partners, a cross-section for New York State, the whole state in both regions of New York City and otherwise, to assess the current landscape of sustainability or reimbursement, who's doing what, identifying the gaps that might exist, as well as to identify some of the opportunities for upscaling, for standardizing, as well as those strategies that can help us get there. And finally, on the other side of things, to identify some of the barriers that might stand in our way to doing that, and then what we might do to counteract that. So that's the first step. We did engage the group in open discussion around that. And then the next step, or the final step in moving forward, will be to develop a plan of action or implementation plan going forward. So with that being said, we do have some key findings that we wanted to share with you today. We'll go over 2 slides, one for New York State, one for New York City, and then we'll summarize them. But they really reiterate some of the key themes that we've already heard today, and the first being professional roles for nurses, community health workers, certified asthma educators, and identifying those professional roles across the board. I think we can all agree that working together and in a meaningful and outcome-driven manner can provide the best patient results within the care team. There's a role for everybody, so we don't need to fight over who's going to do that role. We need to identify how we can work together seamlessly. So that really is the key message that we found that was resounding across the board. The importance also to bring awareness around reimbursement opportunities must also be strengthened with all professionals, whether they're healthcare providers or delivering the educational services. Specifically in credentialed clinical credentials as well as non-clinical credentialing. Okay, so you can do the next one.
Yes, and I have to echo that when the New York City subcommittee also gathered together in the conference call and in the in-person, these were exactly the same topics, and yet we were not in the same table, in the same call with the New York State subcommittee, but it is really great to see that we are in the same boat and we identify the same issues, the same barriers. The other one that we identified that it was also identified by the state subcommittee, it was the discussion around district. And I have to say, even my main role right now is lead the implementation of the asthma project for I have to say, for the largest PPS in the state is it kind of like that's the hat that I'm wearing, and the same questions that we at a PPS level are also trying to address with the state, in like how we're gonna be able to leverage infrastructure. Yes, it's important to identify all these professionals' roles. Like Cindy said, is room for everybody to help that patient. Asthma, we all know, is a multidisciplinary approach, chronic condition. But how can we use this opportunity through district? It was a common question that everybody in the committee brought to the table as we were gathering all this information to present and to share with you. how we're going to be using this trip as a venue to gather these data that it will going to help us to refine in a long term how we're going to make this sustainable, how we're going to create and design the intervention where the patient at the end of the day can feel their asthma, their symptoms are well controlled.
Thanks, Desiree. And then the third key finding that we found in the New York State Committee was really to investigate more the social impact bonds that has been mentioned already today as a new innovative approach to maybe finding new resources and funding streams for those gaps that we see across the state.
Okay. The other topic that with the New York City subcommittee brought to the table, it was the topic in terms of housing providers. And when we we discussed this topic, it was pretty much in identify what are the current services that are provided to a patient in their home. Not only from the clinical component, but also within the social component, who is helping those patients to address in their home environment those other social determinants of health. So it is very important to have a clear understanding that as we provide these services, as the patients are receiving those services, clinical and social, and also legal services, the majority of them, if not all of them, are being provided right now from funding sources. And again, came to the table of the discussion who's going to continue once these fundings end. Conversations were discussed about bringing legislator to the table, going to these the city council's offices, advocate, and bring those topics into the table should be some of the actions that we as a committee could start thinking and try to get us closer to close that gap.
Perfect segue. So the last and summary slide is that we kind of took the results or key findings from both of our committees that were convened separately and matched them up. And so what you see is the beginnings part of a step towards building an action plan. So what we really wanted to do was look at that original task was to create a matrix, a landscape of what is actually provided across our state. And so looking at that and identifying the service gaps and opportunities to address each one of those key findings is really the starting point. So there's a number of tasks that we've identified that are more than we could put on one slide, but it's really the beginning discussion of that process. And then there's also the question of what can we do regardless of the barriers that are in place or the gaps that are in place already. And so what can we do in the meantime collectively while we're figuring this out? Because we know it'll take time to figure that out. We've already spent a decade doing this. So it's important that we move forward and put action into place. And really the most important piece is that this committee is really going to keep going and to build this plan and then be the movers and the shakers across our state. We want everybody in this room to be part of that conversation. So it's a dynamic group. We are exceptionally blessed to have so many valuable and big-brained people in the room to help us put together these thoughts, and we want all of you to be part of it. So please join the group, and we're going to have Amisha be our conduit for that. But it definitely, I didn't ask her if we could do that or not, but so we want to continue the discussion, and so thank you so much for the time today.